Hi, I am Dr. V.S. Rathore. I am a plastic and cosmetic surgeon. Today I will be telling you about the commonly used treatment for face rejuvenation, that is botulinum toxin. Take care of your wrinkles, which we commonly see there on the transverse line on the forehead or the vertical lines in the glabellar areas and the lines around the corners of your eyes. Sometimes we see lines around the nose also. A few peoples you can make out there are dimpling on the chin, and there are neck bends. So these aging features can be taken care of with the help of botulinum toxin. The effect of botulinum toxin lasts for 4 to 6 months. There are many myths. Today I want to clear about those myths. First of all, I'll say, people ask me whether it is safe or not. I always say it is USA FDA approved. Botox is very safe. Some people says, is it a habit forming? I'll say not at all. It is it's habit forming, and it has no side effects, and it can be used by any person from middle age or whoever is having these wrinkles. So the wrinkles can be taken care of with the help of botulinum toxin. In this video, I'll be showing you how to take care of your transverse line, which is due to the contraction of frontalis muscle, and the frown lines, which is a glabellar complex. It is due to two muscles. The vertical lines, which we call it as in common is 11 lines, which is due to the contraction of corrugator supercilii, and a transverse line at the bridge of nose, which is due to procerus. And the crow's feet at the lateral angle of your eye is due to orbicularis oculi. One more thing about botulinum toxin is that it improves the emotional attributes of a person. For example, an angry look, which is due to the vertical lines, the frown lines, due to glabellar complex, can be taken care with the help of Botox. Similarly, tired and sad look due to the transverse line on the forehead can be removed with the help of Botox. That means a Botox is not only doing an anti-aging treatment, it is also removing the negative emotions from the face, thereby making a person more youthful, more younger, and more attractive. One more indication of Botox I'll tell you in a face is that some patient is having excess of this masseter muscle hypertrophy due to a habit of chewing or excess of chewing on the one side. So if they are looking to slim down their jaw, then Botox can be injected into the masseter muscle. Insulin syringe is used to inject the Botox. In case of forehead, you have to deposit 2 units at each point in an irregular way. The angle of needle should be at 45 degree, and the needle depth should be half into the frontalis muscle. You can see it's half deep going into the frontalis muscle. Don't insert the needle too deep and deposit the toxin at the level of bone. Then you won't get the desired effect. One should spare the lower third of the frontalis muscle and inject toxin into the upper and the middle part of the frontalis muscle. And this is a anti-spoke point. Deposit 1 unit at anti-spoke point on both sides, left eyebrow as well as right eyebrow. Now injection into procerus. You hold the procerus between the 2 digits and inject deep into the muscle. Now injecting into the corrugator, the head of the corrugator, one should go full depth of the needle because the corrugator is deep to the frontalis muscle, and inject 4 units. And while injecting into the tail of corrugator, one should go half needle. Otherwise, what will happen? The frontalis will get paralyzed and there will be brow ptosis. Similarly, injecting on the left side, the head of the corrugator, the needle should go deep into the muscle, and while injecting into the tail of corrugator, go superficial. Injecting into the crow's feet, one should inject lateral, that is away from the eye, and it should be very superficial. There should be a bleb, visible bleb, and the direction of needle should be away from the eye. You can see the visible blebs. For injection in bunny lines, one has to inject very superficially on the sides of bridge of nose into the nasalis muscle, which is the site of maximum wrinkling.